65-year-old man presents with facial weakness. He says he noticed that his face appeared to be twisted when he looked in the bathroom mirror this morning. He is otherwise well and does not have any other complaints. He denies any facial pain or paresthesia and has no significant medical history. Patient is afebrile, vital signs are within normal limits. Neurological examination reveals difficulty shutting the right eye tight and inability to bring up the right corner of his mouth when asked to smile. The remainder of the examination, including the left side of the face, is unremarkable. Which of the following is most likely diagnosis in this patient? Options: facial nerve schwannoma, idiopathic facial paralysis, right hemispheric stroke, acoustic neuroma, left middle cerebral artery stroke. All right, so this patient is having a facial weakness, most likely unilateral right-sided weakness, because this patient is not able to close the right eye and is having drooping of the mouth on the right side as well. Now, Bell's palsy, great. It's a lesion in the LMN, okay, the lower motor neuron. Usually a self-limited condition. It's not going to get spread anywhere. But it's the facial nerve palsy. Facial nerve is cranial nerve 7, where patients will be having loss of facial expression. So anything that supplies facial nerve is going to get lost, right? So it's going to cause denervation of stapedius, causing hyperacusis. So even a little sound can be too loud for these people. There's going to be decreased taste sensation in the anterior 2/3 of the tongue. There's going to be decreased salivation because facial nerve also supplies parasympathetic supply to the submandibular and sublingual glands. Okay, so there's going to be decreased salivation. Now this goes when there is an LMN lesion. Now what happens when there is a UMN lesion? That means the patient is having a stroke, right? If you remember, facial nerves, the upper part of the facial, upper part of our face has kind of a dual supply from the cortex directly, right? So when you have a UMN lesion, your upper half of the face is going to get spared, okay? Coming back to the Bell's palsy, which is LMN lesion, is actually a diagnosis of exclusion. You will have to rule out everything such as a stroke, a tumor, a bleed, an abscess, anything that is in the brain that can compress that facial nerve, okay? Treatment is going to be steroids. It's basically conservative. You can give antiviral if it's a virus associated one, and even surgery if it's refractory. So complications of Bell's palsy, patient, as they mentioned, is not able to shut the eye, so there is corneal kind of a dryness and corneal damage. It can cause lacerations and the abrasions as well. So you may need to do the eye care and also lubrications. You can use the eye drops to prevent that damage. But first of all, you need to treat what is causing it, right? So that's the Bell's palsy. Sorry, I'm just going to go over the question. So repeating the bacteria name, it's Borrelia burgdorferi. Are there any risk factors for this palsy? I wouldn't say risk factors, but there are certain conditions that are associated with it. And you can say it can also be idiopathic. That means the patient doesn't even know what is causing it. Okay, so it can be idiopathic or it can be some associated with a viral or bacterial infection. Okay. Now, congenital depends if there is any brain conditions associated with facial nerve. I don't think I've seen any congenital Bell's palsy kind of a situation or even a question. I've never seen it. So, but it's a good point. Could be congenital. More likely in the neuro kind of a situation and neurological congenital conditions, I would assume. But yeah, there are not certain any kind of particular risk factors. It could be bacterial, viral. That's why we can use antiviral as well for its treatment. It can be idiopathic, right? That means we don't even know what is causing it, right? So that's just Bell's palsy. Okay, so let's go over the other options. Facial nerve schwannoma. So yes, it does involve facial nerve. Patients will be having everything that is mentioned in this question, but is it even that common? Like, would that be the first thing that would come to your mind? No, right? Bell's palsy is more common than facial nerve schwannomas, and it's a very, very rare cause of ipsilateral facial weakness. Note that this schwannoma are different from the vestibular schwannoma. Vestibular involves cranial nerve 8. Okay, And facial nerve schwannoma, I think they mentioned that it was like there was, I think it was an article I was reading that they mentioned it was more in the parotid gland because of its trajectory. Facial nerve passes through the parotid gland, so that tumor is actually within the parotid gland, and it can cause that, you know, chewing issues and difficulty eating and swallowing, that kind of a thing, even like salivation kind of a problems. So it's kind of different. Yes, they will have this ipsilateral things along with depending on where the location of the tumor is, causing the mass effect kind of a situation. Okay, so right hemisphere stroke, as I mentioned before, this will cause UMN lesion. And if it is UMN, it's going to spare the upper face. This patient's upper face is involved. They mentioned that he's having difficulty shutting the right eye, right? So he's having upper face involved, and that's why that's not the answer. Acoustic neuroma, as I mentioned before, it's the vestibular schwannoma. Same thing, okay? It involves cranial nerve 8 mainly, but because of the mass effect, it can also involve facial nerve. Okay, but since, as I mentioned before, it also involves 8, you're gonna have hearing loss issues, balance issues with acoustic schwannoma. Okay, so this patient is not having any kind of hearing problems, and that's why that is not the answer. Again, left middle cerebral artery stroke. So middle cerebral artery, if you remember the homunculus, it's going to involve your face and your upper limbs, right? It's going to cause both hemisensory and motor paralysis. This patient is having only motor paralysis. So that's why that is not the answer. Does that make sense?
Thanks for watching. Please give a thumbs up and subscribe for more.